Okay, so what are some of the clinical disorders that we see of the cerebrospinal fluid system? So we can see epidural and subdural hematomas, we can see hydrocephalus, and we can see meningitis. So epidural and subdural hematomas are typically caused by trauma, and the hematoma is bleeding into these spaces, into these kind of meningeal spaces. So when we have we're going to talk more about these in detail also next year when we have their X2. But epidural hematomas are when we have the arteries that are in this space, arterial bleeding between the skull and the dura, in this space above the dura. So it's usually caused by the middle meningeal artery being torn by a fracture of the temporal or parietal lobe. So if you were in a car accident and your the side of your skull hit a windshield, or if you're an older person and you're walking around, a lot of people will fall and hit their head on the side of a coffee table. And if you end up breaking that temporal or parietal lobe, you can sometimes rip that meningeal artery and cause bleeding in that area, in that epidural space. So because it's arterial blood, and we know that arteries are under greater blood pressure than veins, the symptoms, we tend to see these symptoms fast or faster than subdural symptoms. Usually within a few hours, we start to see some symptoms. Slightly different presentation with a subdural hematoma. Now, again, because it's below the dura, that's where we have venous blood, right? And we know venous blood is as we know, veins are under less blood pressure, lower blood pressure. So the symptoms tend to take a little longer to show up. So the symptoms here are slower due to the decreased blood pressure in the veins. So we may not see symptoms. A patient may fall and not see symptoms for days to months. So the rate of progression of the symptoms is different, but most of the symptoms are really similar. And the symptoms that we can see with epidural hematomas as well as subdural hematomas are headaches, vomiting, decreasing consciousness, hemiparesis, Babinski's sign, confusion. So those are some of the symptoms that we see. Now, if we have an older patient who's living at home alone and people don't check on him for a long time, you may not see some of those symptoms, right? So versus if you have a family member or a neighbor that you check on a regular basis and you're used to their normal kind of mental state, and all of a sudden you go in and they seem confused and they're sleepy, or if you feel like they're coming in and out of consciousness, and they have a big bruise on their face, those could be indications that maybe they have fallen and suffered one of these hematomas. We also have problems when the cerebrospinal fluid is blocked. So we can see hydrocephalus when there's a pressure, when the pressure from the cerebrospinal fluid builds up and causes an enlargement of the ventricles of the brain. We see increased intracranial. So this happens oftentimes with children in utero. Physicians can watch as the baby's developing, and they're looking at ultrasounds, and they're looking at a variety of things. And one of the things they're looking at is the size of the head. Is it in proportion to the size of the expected age of the baby? But when we have, for some reason, if the cerebrospinal fluid system is blocked, you can see increase in intracranial pressure. And if it happens when the patient is an infant, those cranial sutures are not yet fused, so the skull is still growing and expanding. So because the sutures aren't fused, the skull isn't solid, the ventricles and the hemispheres and the cranium can expand and get bigger. And then you can see how that baby's head is disproportionately large to the rest of their body. So in this case, sometimes they'll put in a shunt to help drain that cerebrospinal fluid into the peritoneum. So this picture here on the bottom right is a picture of a shunt. However, if this blockage of cerebrospinal fluid happens after infancy, in adulthood or young adulthood, the blockage, because we have skulls that are now fused, right? So in an adult, your brain is solid. I mean, your skull is solid, and there's no place for that extra swelling to go. So then what happens, unfortunately, is now you have brain tissue being pushed up against the side of the skull, being distorted and damaged. And then we see, a lot of other mental status changes. So, they have a different other sets of issues. You can also have meningitis. We've talked a little bit about this earlier in the course. Sometimes we'll see this, particularly at like colleges. You'll hear about meningitis. I think it was a couple of years ago, UMass had a big meningitis breakout. So meningitis is often a viral or bacterial infection that causes inflammation of these layers of the meninges around the brain or the spinal cord. Some of the symptoms of meningitis are headache, fever, confusion, vomiting, neck stiffness. Oftentimes people with meningitis have increased pain as they change to an upright position, with head movement, with sneezing and coughing, or other things that would increase that pressure. But oftentimes we can see meningitis in places like dorms when people are in close proximity to each other and passing on the virus. So now let's take a look at the cerebral blood supply. So, of course, the brain accounts for about 2% of our total body weight, but it consumes about 20% of our oxygen at rest, just for the brain to function. The amount of blood to a specific area of the brain will depend on its activity level, right? Depending on which part of your brain is working hardest at that time, that's where the blood is headed. Oxygen consumption increases from the brain stem upwards toward the cerebrum. So therefore, if we've got more, if our tissue that's in our cerebral cortex needs more oxygen, it's more vulnerable, therefore, to hypoxia or a decreased blood supply and decreased oxygen level. So again, we hear stories about severe head injuries and that patients can stay alive in these persistent vegetative state because of a lack of blood supply. So we may have brain damage in the cerebral hemispheres or in the cerebellar cortex, yet a person continues to survive because of the brainstem. And we know now about the brainstem and its function in kind of those really important breathing, cardiovascular systems. So when there's a lack of blood to the brain for 1 to 2 minutes, we start to see impairments in the area. But at about 4 minutes, that damage becomes permanent. So again, the quicker we can get to folks who have lack of blood supply to the brain, the better. That's why you see a lot of public service announcements on TV about response time to strokes and response time to heart attack, because we really need blood supply to be getting to the brain to maintain function of the heart and the rest of the body. So the blood is also what's carrying the oxygen, the glucose, right, for energy production. So the brain is unable to store glucose, so it needs a constant supply of blood to carry the glucose. Because again, we talked about there's so many nerves and neurons in the brain, and they have a high energy demand. And where's that energy coming from? It's coming from glucose. So decreased glucose, if we start to starve ourselves or are in a position where we are starved, it can lead to dizziness, confusion, convulsions, with loss of consciousness.